When we think of medieval medicine, we often picture a dark age of superstition, leeches, and dirty sawbones. The reality, however, is far more fascinating. Medieval medicine was a highly structured, surprisingly logical system based on the classical texts of antiquity. It was also heavily connected with theology, astrology, and early botany. In this fascinating era, a physician wouldn't just check your physical symptoms. They would consult the alignment of the planets, firmly believing that celestial bodies dictated the very flow of human health and disease. The four humors and the cosmic balance. At the very heart of medieval medical theory lay the concept of the four humors. Inherited from the ancient Greeks, especially Hippocrates and Galen, this theory dictated that human health was governed by four vital fluids: blood, phlegm, yellow bile, and black bile. To a medieval physician, illness wasn't caused by germs, which wouldn't be discovered for centuries. It was caused by an imbalance of these humors. If you had a fever, it meant there was too much blood in your body, in other words, too much of the hot and wet humor. What is the logical course of treatment then? To remove the excess blood. This led to the widespread practice of bloodletting, either through localized leeching or by opening a vein. Physicians relied heavily on tools like the zodiac man or the vein man, anatomical charts that dictated exactly which vein to cut, based on the patient's ailment and the current astrological phase. A physician wouldn't dare bleed a patient from the arm if the moon was in the wrong zodiac sign, fearing it would lead to catastrophic humoral collapse. Diagnosis was primarily done through uroscopy, the visual examination of urine. A physician would hold a glass flask up to the light, checking the color, clarity, and sometimes even the smell and taste of the urine to determine which humor was out of balance. The Barber-Surgeons. While university-trained physicians handled the internal humors and theoretical diagnoses, they considered it beneath them to actually cut into a patient. Furthermore, in 1163, the Church passed a decree forbidding monks and priests, who made up a large portion of the educated medical elite, from shedding blood. This is when barber-surgeons entered the scene. Since barbers already possessed sharp razors for cutting hair and shaving beards, they simply expanded their services. If you lived in the 14th century and needed a tooth pulled, a fractured bone set, or a limb amputated, you didn't go to a doctor, you went to your local barber. They carried out these painful procedures without modern anesthesia, relying on alcohol, opium, or a sharp blow to the patient's head to dull the pain. Did you know that the traditional barber's pole outside today's salons is a direct nod to the bloody history of medieval barber-surgeons? The red stripes represent blood, the white stripes represent the bandages used to stem the bleeding, and the pole itself represents the wooden stick the patient gripped to make their veins bulge during a bloodletting procedure. Monasteries and the power of botanicals. If you were a commoner who couldn't afford an elite physician or a barber, your best hope lay in the local monastery or a village healer. Monasteries were the beating heart of medieval healthcare. They housed large infirmaries for the sick and maintained meticulously cultivated apothecary gardens. Monks and nuns were expert herbalists. While some of their remedies sound absurd today, like using a paste of roasted onions and pigeon droppings to cure baldness, many of their botanical treatments were highly effective. For instance, they frequently prescribed chewing on willow bark for headaches and joint pain. Centuries later, scientists discovered that willow bark contained salicin, the active chemical precursor to modern aspirin. They also utilized honey for dressing wounds. We now know that honey has natural antibacterial properties and creates an osmotic gradient that draws moisture out of bacterial cells, effectively destroying them. This blend of spiritual care and practical herbalism meant that monastic hospitals were often the safest places to recover from a physical injury. The Black Death and the Plague Doctor. The medieval medical system faced its ultimate, devastating test in 1347 with the arrival of the Black Death. Bubonic plague swept through Europe, killing up to a third of the population. The rigid, ancient texts of Galen offered no explanation and no cure for the blackened buboes and swift death the plague brought. Desperate times birthed desperate measures. The prevailing theory was that the plague was spread by miasma, corrupt, foul-smelling air. To combat this, people carried sweet-smelling poses of herbs to purify the air they breathed. Though the iconic plague doctor outfit with the terrifying bird-like mask became more standardized during later outbreaks in the 17th century, its conceptual origins trace back to these medieval miasmic theories. The long beak was stuffed with aromatic spices, like camphor, mint, and rose petals to filter out the poisoned air. They carried long wooden canes to examine patients without touching them, and wore heavy, wax-coated leather coats. They had no idea that their thick skin actually provided excellent physical protection against the real culprits, plague-carrying fleas. Medical advice during the plague ranged from the bizarre to the macabre. Some doctors recommended tying live toads or shaved chickens to the swollen lymph nodes to draw out the poison. Others prescribed drinking expensive potions made of crushed emeralds. The dawn of Renaissance anatomy. The sheer failure of traditional medicine to stop the Black Death inadvertently sparked a medical revolution. Physicians began to realize that unquestioning reliance on ancient Greek texts was holding them back. To truly heal the human body, they needed to look inside it themselves. In the late Middle Ages, the strict taboos against human dissection began to soften. Pioneers like Mondino de Luzzi staged public dissections in universities, shifting the focus from abstract humors to concrete, physical anatomy. This era laid the crucial groundwork for the Renaissance, eventually leading to brilliant anatomists like Andreas Vesalius, who mapped the human body with unprecedented accuracy. Medieval medicine was not merely a dark era of ignorance. It was a complex transitional period where blind faith and astrology slowly began to give way to empirical observation and practical surgery. Medieval healers did everything they could, using the tools and knowledge available to them, and laid the fascinating and often bloody foundations for the modern medicine on which we rely today.